Hi, I'm Dr. Sally Goza. We come to you virtually, but our pride in you is very real. And while we can't be together in an auditorium, I know your families must be so proud of you and all you're doing to advance global child health.
Hi, I'm Dr. Lee Beers. Your work as advocates for medicine, research, and innovation is more important than ever as the world wrestles with COVID-19 and the health and social inequities that are hitting some populations especially hard. We want to make sure all children are getting the best possible care, and we particularly worry about those with complex medical conditions who may be at risk or having a hard time getting the care they need. Here at in DC at Children's National, when the pandemic first started, we quickly realized that many of the children in our city were not able to easily access testing for a lot of different reasons, either availability of the test at their doctor's office, lack of transportation, fear, or lack of information. So some of the leaders at our hospital and in our community pulled together and in less than 1 week stood up the first drive-up or even walk-up testing site in the nation for just children, staffed fully by hospital volunteers. We made sure it was easy and safe and welcoming. We had interpreters available for our non-English speaking patients and crayons and coloring pages for kids once they were done their tests. I remember one of the days I worked there, a family came with their children for testing who spoke only Spanish, whose mother was not able to read or write, and who were very scared because they didn't know what to expect or what some of the worsening signs of COVID might be. Together with the interpreter, we were able to help her fill out the needed paperwork, provide education and reassurance, and do her testing in a safe and supportive way. Dr. Goza, I know that even as president of the AAP, you're still seeing patients in the office. Do you have a story you'd like to share with us?
I do. When the COVID-19 first hit, patients were really scared to get out of their houses. And so we had patients calling saying, we're scared to come for our appointment, but my child needs their immunizations. And so we quickly adapted to that. We quickly made so that we had patients coming in one at a time and putting them directly into a room. We got rid of our waiting rooms so we could reassure our parents that it was safe to come in. But I still had this one mother with a 1-month-old, and she would make an appointment. We would call her and we'd tell her all the things we were doing, and she would go, okay, I'm going to come in. And then her appointment time would roll around and she wouldn't show up. So I finally called her and I said, I just need to talk to you. I said, we really need to get your child in for that checkup. We need to make sure they're gaining weight and that you're doing okay and to get those vaccines in. And she goes, but Dr. Goza, I'm just so scared. I'm a first-time mother and I am really, really scared. And so she and I had a long conversation and I finally convinced her that I would see her before the office opened. So she came in 15 minutes before the office opened the next day. We got that child in, we got the checkup done, and she was so thankful. And she was not scared anymore after that, which was really good. So we really sometimes have to meet patients where they are during these types of times. The American Academy of Pediatrics really believes that all children have the right to a healthy future. And I know what stirs in your heart, it stirs in our hearts as well.
Yeah, really. I've wanted to be a pediatrician since I was almost 5 years old. I really wish iCAN had been around when I was in school, because it's so important to be connected with people who share your goals and values. I think this pandemic has really illustrated the importance and the beauty of relationships, just driving home the value of human connection, the impact of loneliness on health, and the healing power of community. While it's a very challenging time, you will all come out of this even stronger and more resilient. I think back to the time when I was a brand new pediatrician in the United States Navy. I was assigned to work at a hospital in an incredibly remote place. I was the only pediatrician there, and it was a very lonely and isolating place to be. I was there for a year and a half, and it felt like forever. But when I look back, it taught me to believe in myself, and I learned some of the most important lessons and skills of my career during that time. I really, truly believe it set me on a path to be where I am today as a leader in pediatrics. Dr. Goza, I'm sure you've had a time like that in your career as well.
So I'd like to talk about a time before I went to medical school. I was a junior in college, and I was on a family trip with some of my relatives who actually were already doctors. And they were talking to my younger brother, who was still in high school, about when you get to be a doctor, you can come work with us. And so I chimed in and said, well, what about me? What about me when I become a doctor? And my cousin said, well, we'll see if you get into medical school first. I was devastated. I thought, oh my goodness, I cried. My dad was like, what is wrong? When he found out what my cousin had said, he was furious. He told my grandmother, which I did not know. So fast forward, and I was in my senior year of college, and I got my acceptance to medical school, and I went to tell my grandmother, and my grandmother just grinned from ear to ear, and she says, you showed those boys. You got in on the first try, and they had to try twice. So always believe in yourself, but know you've got people to back you up as well. So at iCAN, you have built a community. So make sure you stay in touch and be on call for each other. And know you will always have a friend and ally in the American Academy of Pediatrics. Finally, there is a strong need for your advocacy on both the biological and non-biological issues of the world. So keep studying the problems, sharing your research, coming up with solutions, and telling your stories, because your stories could be very persuasive. Sharing your truths and experience with how regulations, policies, and legislation affect you and your family inspires key policy and decision makers to act. And they certainly are more compelling than listening to adults cite studies and facts.
Yes, definitely. Absolutely. Really know the power of your stories. Lift them up to fight injustice and give all children the same prospect of good health and a productive life, regardless of race, gender identity, or socioeconomic status. Work to ensure the future of the planet and the health and the safety of its people.
And while we'd love you all to become pediatricians, it's the best job in the world, the Academy will be cheering you on no matter what you do. You are the leaders of our future. Be great and stay well.